Nairobi, the COVID-19 epicenter in the country, faces a looming crisis. Doctors working in the capital say they will go on strike on the 21st of this month, 7 days from today. The Kenya Medical Practitioners and Dentists Union Nairobi branch cites delayed salaries, especially for health workers on contract, lack of medical cover for practitioners, and poor quality protective equipment issued to the health workers. The strike notice comes amid surging numbers, with more than 16,000 people infected in Nairobi, which accounts for more than half of the nationwide COVID-19 infections. Elphas Lagat has the details.
In 1 week, doctors may paralyze operations in hospitals, quarantine and isolation facilities within the city if their demands are not met. KMPDU Nairobi chapter is faulting Nairobi County for failure to look into their welfare and safety as frontline workers in the fight against COVID-19.
So I've been forced, whenever we contract COVID or become sick, to contribute amongst ourselves to sort out our medical problems.
At least 15 doctors who have contracted the novel coronavirus, Dr. Thuranira says, have been forced to foot their own bills or rely on the goodwill of fellow medics.
So they have 7 days starting today to resolve their crisis, or else we go on strike. Let me tell you, the last statement is that doctors are not martyrs. We are not martyrs. We are not children of a lesser God.
As per the current collective bargaining agreement registered in court, all doctors are entitled to comprehensive medical cover. Delay in addressing the doctors' concerns, Ministry of Health officials say, was due to the transfer of key functions, including health, between the Nairobi County Government and the Nairobi Metropolitan Services.
Following the institution of the NMS, there was a slight delay in the transfer of payroll from Nairobi County to the NMS.
The looming strike seems to cast a cloud of uncertainty over Nairobi, which has been the epicenter of the pandemic since the onset. Ministry of Health statistics show that at least 16,000 of the total infections are from Nairobi. Today's figures also indicative of high prevalence in the capital. 375 cases of the 580 confirmed cases were from Nairobi. This equates to 64.6% of today's infections. At the same time, 5 COVID-19 patients succumbed, taking the tally to 465. 198 patients recovered, raising the total number of recoveries since the onset of the pandemic to 15,298. With health workers in Nairobi threatening to strike in a week's time over continued grievances, it remains to be seen whether the Ministry of Health will act decisively to avert a crisis in the capital. Elphas Lagat, Citizen TV, Nairobi.